All right, let's dive into endotracheal intubation.
Sounds exciting, right?
Well, when I saw intubation, I was thinking tubes, and that's it.
Uh-huh.
But actually looking at these medical training materials,
Yeah.
there are so many decisions involved. Like, how do you choose the right technique?
It's a lot more than just sticking a tube in, for sure.
Right. You have to think about the patient, like what they need, how urgent it is,
Right.
all the risks, the benefits.
Exactly.
So before we get too deep into the detail,
Sure.
let's start with what intubation is. It's all about securing an airway, right?
Yes.
Like getting a tube in there.
So it involves putting a tube, usually through the mouth or nose, down into the trachea. That's your windpipe.
Yeah, okay.
And this lets doctors do a few things. Help the patient breathe, for one.
Okay, so it's for when someone can't breathe on their own.
Right. But it's also about protecting the airway. Like if there's an obstruction,
Got it.
you can use it to clear out secretions.
So suctioning.
Exactly.
Yeah.
And even to give medication.
Wow, so it's not just for breathing problems.
Nope. It's a pretty versatile tool for doctors.
Okay, so multi-purpose.
Multi-purpose.
All right, so the first method we're going to talk about is orotracheal intubation.
Okay.
Our sources say it's the most common,
Mm-hmm.
and a lot of times it's what they use in emergencies.
Yeah.
What makes it so good for those high-pressure moments?
Well, in an emergency, speed is key.
Yeah.
Orotracheal intubation, that's where the tube goes through the mouth.
Right.
It's usually the fastest way to secure an airway
Okay.
and the least traumatic.
Makes sense. And our sources talk about some other advantages, too, like being able to use a bigger tube,
Right.
which I guess helps with airflow, right?
Absolutely.
And it's easier to suction
Yeah.
to clear any blockages.
Uh-huh.
And they even mentioned it's better for doing a bronchoscopy.
Right, because a bronchoscopy is where doctors look directly into the lungs.
Ah.
They use a thin, flexible tube with a camera.
So you need that access.
Exactly. And you mentioned the larger tube.
Yeah.
That reduces resistance to airflow.
So the patient doesn't have to work so hard to breathe.
Exactly.
Okay, so it sounds like it's a pretty solid choice.
It's a good option in a lot of cases.
But I imagine there are some downsides. Our sources mentioned accidental extubation.
Oh, yeah.
That's when the tube comes out, right?
Unexpectedly.
Unexpectedly.
Yeah, that can be a serious problem.
And there's also a chance the tube could go down the wrong airway.
Yes. Those are both very serious concerns.
Wow.
And there's a chance the patient could bite down on the tube,
Oh, of course.
obstructing the airflow.
Okay, right.
And then there's the possibility of injury during the procedure or aspiration.
Aspiration.
That's when something goes down the windpipe
Mhm.
instead of the esophagus.
So it's not as simple as just sticking a tube in, huh?
Well, it sounds simple,
Right.
but the airway can vary a lot from person to person.
Right.
And that can affect how easy and how safe it is to intubate.
So it's not just about speed, but also about
Right.
the individual patient and the risks.
You got it. And that's where the next method we're going to talk about comes in. Nasotracheal intubation.
Okay, so this is where the tube goes through the nose, right?
That's right.
So what kind of situations would make that a better choice than going through the mouth?
Well, imagine if the mouth is injured or blocked,
Okay, yeah.
or they just can't access it for some reason.
Right, right.
Nasotracheal intubation gives you another way to reach the airway.
Okay.
And it's often the preferred method for longer-term ventilation.
Go longer term. Okay, I'm curious about that. What makes it better for those situations?
Well, think about it. If you have a tube down your throat for a long time, that's got to be uncomfortable.
Yeah, it's got to be.
It can make it hard to talk, eat, swallow even.
Oh, wow.
Nasotracheal intubation kind of bypasses all that,
Okay.
makes it more comfortable for the patient.
Makes sense. It's interesting how something as simple as where the tube goes in can have such a big impact on how the patient experiences it.
Right. It can make all the difference.
And our sources actually pointed out a few other surprising advantages of nasotracheal intubation.
Okay.
They said patients tend to gag less,
Uh-huh.
and it's easier to talk and even, get this, swallow with the tube in place.
Yeah, I know it sounds counterintuitive.
Wait, swallow? With the tube in your nose? How is that even possible?
I know, right? But remember, the tube completely bypasses the mouth and vocal cords,
Okay,
so less chance of triggering those gag reflexes.
got it.
And it can actually make it easier to swallow naturally.
Wow, that's fascinating. But I'm guessing there's a downside to this method too, right?
Of course.
Nothing's perfect.
There are always trade-offs.
What are they?
Well, for starters, it can be harder to get the tube in through the nose.
Oh, right. Yeah.
More uncomfortable for the patient, potentially.
Okay.
And there's a bigger risk of complications. Nosebleeds, sinus infections, that kind of thing.
Makes sense.
Yeah.
And I'm guessing you can't use as big of a tube, right?
You're right. The nasal passages are just narrower than the mouth. So
Okay.
you're limited in the size of the tube.
Right.
And that might be a problem in certain situations.
When you need maximum airflow.
Exactly.
Okay, so even though nasotracheal intubation has some cool advantages for longer-term ventilation,
Yeah.
it's not without its downsides.
Right. Just like with orotracheal intubation, doctors have to think about the benefits,
So go
weigh the risks
for each patient
for each patient.
and decide what's best.
Exactly. Okay, so we've talked about going through the mouth, through the nose,
Right.
but our sources mention another option.
Okay.
Tracheotomy.
Tracheotomy. That one sounds, I don't know, more intense.
It is more invasive, yeah.
Yeah.
So instead of the mouth or the nose,
Right.
tracheotomy is an incision directly into the trachea,
Into the windpipe.
through the neck.
Yeah. Through the neck. Okay. Why would a doctor choose that over the others? It seems like a lot
Yeah.
compared to just putting a tube in through the nose or mouth.
It's not the first choice, for sure.
Right.
They usually save tracheotomy for when someone needs long-term ventilation
Okay.
or when the upper airway is blocked,
Okay.
damaged, so they can't use those other methods.
So like if someone had a really bad facial injury
Exactly.
or a tumor blocking their airway.
Yeah, in those cases, a tracheotomy might be the only way to get an airway.
Wow. Okay. Because it bypasses all of that.
It goes straight to the trachea.
Okay. But wouldn't making an incision in the neck be riskier?
Well, any surgery has risks, of course.
Right.
But for long-term ventilation, tracheotomy can actually be safer.
Oh, okay.
Think about it. A tube rubbing against your mouth or nose all the time.
Yeah.
That's going to cause irritation.
Right.
Sores, infections.
Yeah, that makes sense. I hadn't thought about the long-term effects like that.
Right. So with a tracheotomy, the tube is directly in the trachea,
Okay.
bypassing all that sensitive tissue.
Right.
So it tends to be more comfortable for the patient.
Okay.
And it makes things easier, like talking, eating,
Yeah.
even oral hygiene.
Wait, hold on. Someone with a tracheotomy can still talk and eat. I thought that wouldn't be possible.
It depends. It really does. It depends on the type of tube they use.
Okay.
And the patient, of course.
Right.
But in a lot of cases, yes, they have special valves and speaking aids that attach to the tube
Wow.
so they can talk. And since the tube bypasses the mouth completely,
Right.
it can actually be easier to eat and swallow than with those other methods.
Wow. That's amazing. So it's like tracheotomy gives you more functionality
It does.
and comfort
Yeah.
when you need ventilation for a long time.
It can, yeah. But it's important to remember it is still a major surgery.
Right.
And it has its own risks.
What kind of risks?
Well, the sources mention scarring,
Of course, yeah.
infection, bleeding. And I imagine it's more expensive than the other methods, too. All valid concerns. And it does require more specialized care equipment,
Right.
which can add to the cost.
So it has some unique benefits,
It does.
but it's not a decision to be made lightly.
Right. It's a big decision.
You have to think about the individual patient,
Yeah.
the situation, the risks, the rewards.
Lay it all out. Exactly.
Okay, so we've talked about these three methods.
Hmm.
Through the mouth, through the nose, and tracheotomy.
Uh-huh.
But our sources mentioned one more.
They did.
That's a bit more specialized.
A bit more niche, yeah.
Endobronchial intubation.
Endobronchial intubation.
That sounds complicated.
It is a bit more complex.
What makes this one different?
Well, it uses a special tube
Okay.
called a double-lumen tube.
Oh, well, lemon.
So basically, it's two tubes in one,
Okay.
and this lets doctors ventilate each lung separately.
Wait, each lung separately. Why would you need to do that?
It's mostly used for surgeries that need one lung isolated, like a lobectomy.
Lobectomy.
That's when they remove a lobe of the lung,
Ah.
or a pneumonectomy when they take out a whole lung.
Wow. Okay, so in those cases, you need to keep one lung inflated while they're working on the other.
That's it.
Oh.
And there are actually specific types of double-lumen tubes for each lung.
Really?
The Carlin's tube, for example, is angled to go into the left main bronchus. That's the airway to the left lung.
Okay.
And the white tube is designed for the right lung.
So it's like having a specialized tool for a very specific job.
Exactly.
Okay.
It's not as common, but it's super important for those types of surgeries.
Right.
And it shows how precise intubation techniques have become.
It's amazing how far medical technology has come.
It really is. And it shows that even though intubation might seem simple,
Yeah.
there's a lot of thought that goes into it.
Right?
Skill, decision-making, to choose the right method.
It's not one size fits all.
Yeah.
You got to consider all those factors we talked about
Right.
to make sure it's safe.
it's ineffective. The patient's medical history, the urgency of the situation, how long they'll need ventilation, all the risks and benefits of each method.
It's a lot to balance.
It's a complex decision.
But it's important to get it right.
Absolutely. It's crucial for taking care of patients who need help breathing.
So we've talked about all these different methods of intubation. But what happens after someone's intubated? What kind of monitoring and care do they need?
That's a really important question because intubation, that's just the first step.
Right.
Once they have an airway,
you
need to monitor them. Make sure they're doing okay.
So what does that monitoring look like? What are the main things doctors are watching for?
Well, they're going to be keeping a close eye on the patient's vital signs.
Okay.
Heart rate, blood pressure, oxygen levels, breathing patterns, all of that.
So basically making sure they're stable.
Exactly. Making sure the intubation is working, that they're getting enough oxygen.
Makes sense.
They'll also be checking the tube.
Okay.
Making sure it hasn't moved.
Ah, so it doesn't come out.
Exactly. Remember we talked about accidental extubation?
Yeah. That could be dangerous.
It can be. Especially if the patient's moving around coughing.
Right.
So they have to secure that tube.
Yeah.
And keep checking it.
Okay. So vital signs, tube placement. What else?
They also have to manage the patient's sedation.
Oh, right. Because being intubated can't be comfortable?
No, it's not.
And kind of scary, I imagine.
Absolutely. So sedation helps keep them calm.
Okay.
Comfortable. And they'll give pain meds too.
Of course.
For any discomfort from the procedure.
It sounds like a whole team of people are involved.
Oh, yeah. It's a team effort for sure. Doctors, nurses, respiratory therapists.
Wow.
Everyone working together to make sure the patient's getting the best care possible.
So even though putting the tube in, that's the big thing everyone thinks about.
Yeah.
It's really just the start of a longer process.
It is.
Okay, so switching gears a bit.
Sure.
What do our sources say about new technology? Like, are there any cool new tools or techniques coming out?
Well, there's one area that's seen a lot of progress.
Okay.
Video laryngoscopy.
Video laryngoscopy. Okay, that sounds fancy. What is that?
So instead of the doctor just looking down the patient's throat,
right,
with video laryngoscopy, they use a camera.
A camera?
Yeah, it's attached to the laryngoscope blade.
So like a tiny GoPro?
Yeah, something like that. And it shows a video on a monitor.
Okay.
So the doctor can see everything close up.
Oh.
High definition.
That must make it so much easier to see.
It does, especially in those tricky cases where it's hard to get a good view.
Right. Like if someone can't move their neck very well?
Exactly. Or if they have some unusual anatomy.
So it's like having an extra set of eyes.
Pretty much. But, high definition eyes.
High definition eyes. That's awesome.
And there's another interesting development.
Okay, what is it?
Supraglottic airway devices. They call them SIDs for short.
SIDs? That doesn't sound very good.
Don't worry. They're not sad at all.
Okay.
They sit above the glottis.
Okay.
Which is the opening to the trachea.
Right.
And they create a seal so you can ventilate.
Okay.
But you don't actually have to put a tube into the trachea.
So it's less invasive.
Exactly.
In certain cases.
Right. And SIDs are easier and faster to put in.
Oh, wow.
Than an endotracheal tube. So that's a big advantage in emergencies.
Yeah.
Or for short-term ventilation.
Like a real game changer in those critical moments.
Yeah, they have the potential. And all of these advancements, they show that intubation is always evolving.
Yeah.
Researchers and doctors are always looking for ways to make it safer.
Right.
Better for the patient.
Well, deep divers, we've covered a lot in this deep dive.
We have.
We talked about all the different ways to intubate someone.
Right.
How doctors decide which way to use. How important it is to monitor patients after they've been intubated, and even some of the amazing new technology that's being developed.
It's been a fascinating look into intubation.
It really has.
Yeah.
I hope you all have a better understanding of how complex it is.
Yeah.
And how important airway management is.
It's literally life-saving.
It is. So next time you hear intubation, don't just think about the procedure itself.
Right.
Think about all the skill and technology that goes into it.
Yeah.
And the dedication of all the healthcare professionals who make it possible.
Absolutely.
Well, until next time, deep divers, keep exploring.
Keep
questioning.
And keep diving deep.